Hello everyone, my name is Abdul Mohsen and I'm going to talk about job satisfaction among nurses. I've been working as a registered nurse for several years in several hospitals back home country. I've been witness the most important issue affect nurses in their work is job satisfaction. There are shortages of nurses, there are a high number of turnover, there are too many nurses doesn't work perfectly in their job and the most important factor associated for this issue is job satisfaction. In this presentation, I will discuss 3 key points for this issue. Firstly, what's the meaning of job satisfaction? Secondly, what's already known about job satisfaction from some literatures? And finally, why we need to explore the impact or the influence of leadership style on job satisfaction. Let's begin with the definition of job satisfaction. According to a study by Choi, job satisfaction is manifested as employee commitment that results from an increased sense of meaningfulness at work and improved accomplishment. There are some factors that affect job satisfaction. According to a study by Alotebi, he mentioned educational opportunities, support, nursing image, favoritism, working environment and religion influence job satisfaction. So someone asked, does job satisfaction has a wider impact? Absolutely yes. It can be cover nurse, affect the work, affect the relationship with the teamwork and colleagues, affect the economic status of the hospital and healthcare or health organization, and the most important one is patient satisfied. For example, according to study by Vermeer, job satisfaction affects the communication between team worker and the nurse fall in medication error. And he report 70% of about 2,500 accidents in healthcare were caused by faulty communication within a team. So what's already known about job satisfaction from existing literature? Firstly, job satisfaction associated with some issues such as burnout, stress, tension with co-workers, affect the communication between teamworks and lead some nurses to turn over. Secondly, affect the economic. Fall patient in medication error affect United States 42 billion. Lead nurses to turn over affect between 25,000 to 88,000. Replacement of the registered nurse and those who has long experience affect about 48,000 to 64,000 per year. The most important third item is patient outcomes. Affect the quality of nursing care. Patient will not be satisfied. Nurse will express negative emotion to patient and their family, fall in malpractice. And by statistics, around 100,000 patients die and 1 million are injured each year in United States regarding by job or affected by job satisfaction. Affect the nurses to fall in this issue. So what we have to do, we have to discuss how to promote job satisfaction among nurses. There are some study, for example, study by Niskala was found spiritual intelligence and professional identity improve job satisfaction for the nurse, where other study by Alotebi was found religion has a very important factor to elevate job satisfaction among nurses. So we have to find or we have to prepare the manager. We have to find what's the suitable leadership style, and we have to do some research could find the suitable solution for job satisfaction and elevate job satisfaction for the nurse. To conclude, in the conclusion, we have to address this issue. Job satisfaction is not easy. We have to pay attention for this issue. We have to prepare manager. We have to address this gap, and we have to be careful to elevate job satisfaction among nurses to avoid so many problems in the future.